next shock I will be covering is obstructive shock. An obstructive shock is basically something is blocking the perfusion from happening in the body. And that is not good, because without the lack of perfusion, it will turn into hypoperfusion, and this is why we have shock. And then we have a poor MAP score, and the body goes downhill quickly if it's not fixed. And it basically causes mechanical obstruction of the cardiac muscle, which in turn, this type of shock will obstruct the way the heart flows blood throughout the body. And some of the common causes are a cardiac tamponade, where trauma, blunt force trauma to the chest area that creates blood to pull in the pericardial. Tension pneumothorax, there's a pressure in the thoracic cavity, and there's air that expands, goes out in the chest where you don't want air to be, and it creates the pressures off. And then pulmonary embolism could be another cause of obstructive shock. And with the fluid building up around the heart, it could ultimately cause the heart to fill up with fluid instead of blood, and that's not good. Basically, the treatment for this would be contact ALS and get into route to the hospital as quick as you can once you recognize it, and continue to monitor the vital signs within every 5 minutes or faster, because of the body will go downhill quickly and turn into decompensated shock. And this is the reason for treating for shock, is for putting a blanket on them, keeping them warm, trying to keep the temperature of their body up, and then obviously giving them oxygen to keep oxygen coming into their body, along with that's basically the only treatment EMTs can do, because we can't go in and perform any surgery or anything to stop the obstruction in the body.